I'm Susan Lowry O'Connell, and I'm here today to talk to you about school-based services that we have available here through CommQuest. In school-based services, we actually have a wide range of services. We have early childhood mental health consultation that's called the Childhood Resiliency Project, and we see teachers, children, and families from 0 to age 6. We also have school-based prevention services, and those are programs designed to build students' skills and leadership abilities and resiliency, and also help them to make healthy choices, and those are available in K through 12 grades. And we have school-based mental health, which is a fascinating program and very helpful to schools and families, where mental health providers actually partner with school districts, and we're available in the schools so that we can see your students in the schools, help them be successful at school and at home, and help parents address some of those barriers. Sometimes getting to offices is difficult with work schedules or transportation, and so this is really a valuable service that we have available for you. So how do you get your student connected and who's eligible for services? For our early childhood mental health consultation, our Childhood Resiliency Project, we are available in over 30 centers across Stark County. And so if your child is in a child care center, Head Start, a pre-K program, or a school-associated pre-K program with a public school system, ask if we are partnering with those programs, because every child in the pre-K classrooms where CommQuest Childhood Resiliency Project has support will receive services. We work with the kids to build their skills and strengths. It's a strength-based program to really help your kids build attachment, initiative, and self-control, and be successful as they move on to our public school system. To enroll in our prevention services, again, we're in 14 districts across Stark County, and if your school has one of our prevention programs, we use evidence-based curriculums, lessons, and activities for your students. You simply need to ask your counselors or teachers or principals at your schools and indicate that you would like your student to be involved. The programs are targeted toward all students, but also we really want to invite and engage those students who might have some risk factors, who might have some early challenges, to get them going in the right direction and on track so those challenges don't continue on and become bigger issues. For school-based mental health services, now that's a little different. School-based mental health partners with school counselors at your school, and we see those children who really warrant treatment or clinical services. That's for students who have a diagnosis, either mental health or alcohol or drug challenges that need treatment. In that particular case, your student would get a diagnosis, they would be evaluated, parents will participate so that we get your information and feedback, and we would work with your student in the school in order to help address those barriers that are making being successful in school and at home and with their peers kind of a problem. And so school-based mental health is the one area in which not every child will participate. It's specifically for those children who already have some challenges and who need that extra level of support and treatment. And for those, and also for those families who might have difficulty getting that student to services in an office setting. Another part of school-based mental health that often people don't think about is that we provide support to the schools as well. We work with teachers, we sit in on care teams and help give them information. We do parent engagement activities. And so one of the advantages to having a school-based mental health provider at your school is that we're not only supporting just those students who need services, but also really helping the whole school to address school climates, to address barriers and challenges, and to really help all of our students be as successful as possible and help support our teachers too. So now some of you may have questions about these services sound great, or I would like my child to get involved, but what is the cost? You know, you have questions about that, and it's an important consideration. The really good news is for our early childhood resiliency services, there is no cost to families for participating. It's just a question of whether or not the early childhood program or pre-K classroom your student is enrolled in participates with our program. So ask them if they do, and if they don't, have them reach out to us. We would be glad to see if we can work with them. For our prevention program, again, the good news is there is no cost to families to participate. We get great support from our local Mental Health and Addiction Recovery Services Board, as well as from state and federal funds that cover the cost of prevention services. So we can offer these lessons and activities to students to help make them better and stronger and more resilient and make good choices through no cost at all. It's just a matter of seeing, does your school participate in prevention services with CommQuest? And if not, encouraging them maybe to reach out, or expressing to them that maybe the students in your school would be interested and would like to participate. The one difference is for school-based mental health, because it is a clinical service, it's a treatment service, there is a charge for services. However, we would work with the family. We get your insurance information, whether that's Medicaid or a specific insurance program, and likely we see what services are covered, what copays or deductibles you might have to face, and we would let you know that up front so that you have full information. In addition, CommQuest is really committed to getting services to individuals who need help. We want to offer hope to everyone. And so if finances are a barrier to you, we do have access to some resources that would help you if you do have copays or deductibles that would be a barrier to services. So please reach out to us. We really look forward to working with you.